administration, the FDA, also out with a new book about the pandemic called Uncontrolled Spread. We're glad to have you, Doctor. Appreciate it. As we go through this, do you understand why there are still some people who are still somewhere between concerned, confused, and hesitant about the vaccine?
Well, look, it's not just that the guidance has been shifting. It's that we didn't really have the right institutions in place to inform us of data that could create the kind of analysis that would underlie good recommendations to the public. And this is a big part of what I talk about in the book. We didn't have the right institutions. We relied on the CDC to surface information, do analysis, and try to inform policymakers. And it's a very retrospective organization. It's much more comfortable collecting data and doing careful analyses that might span over 4 or 5 months. What you really needed in the setting of a public health crisis was a real-time organization that could surface information, even partially informed information, to inform current policy decisions that had to be made. And when the CDC did issue guidance, they oftentimes don't articulate what the scientific basis is for the guidance and what their level of certainty is around the different recommendations they make. So people can't make judgments for themselves about which recommendations are going to follow with more vigor than others. So we need to change the process by how we collect information in a public health crisis and in how we analyze the information to try to derive conclusions that can inform people's behavior.
At least based on what you're saying, 18 months in, and we're not any better at this. The CDC guidance still seems to be arbitrary and confusing, especially with the head of the CDC overruling her own board and not really explaining why.
Well, look, the CDC guidance isn't any better. We don't have a process that's better at doing this. I think we recognize what the shortcomings are.
Why in 18 months? I mean, you point this out in a book. You've had time to write a book about it. Why in 18 months in the middle of a pandemic haven't we been able to get any better?
It's going to require different institutions with a different culture and a different mindset. Right now, we're still relying on CDC to issue a lot of these recommendations. And it's not just around the vaccine. It's things like, should we be putting students 6 feet apart or 3 feet apart? This constantly shifting guidance that wasn't really based on good underlying science in the first place. And it isn't that we got things wrong, because in the fog of viral war, we were going to get things wrong, and there were things that were less certain than others. I think the challenge is that we weren't really upfront with Americans about which things were more certain and which things were more speculative, and then we were slow to change the guidance. What we really needed was a sort of JSOC for public health information, Joint Special Operations Command. What we had was the Harvard School of Public Health that was far more deliberative and slow. The vaccines are a separate issue. What we applied to the process for deliberating whether or not boosters should be made available to the American people was a process that was designed to be very deliberative, and it was designed to allow FDA and CDC to essentially reach different conclusions based on the same information around the same questions. And the reason the process was designed that way, it was sort of inherently designed to create some conflict, was because its primary mission was to make decisions about what goes into the childhood immunization schedule. You want those decisions to be slow, careful, deliberative, because that's a very weighty decision, what you're going to mandate that children have to receive in order to go to school. But for an adult vaccine, where it's discretionary whether adults take it, where you have to move quickly in the setting of a public health crisis, you want to try to align the agencies up front so you can get consensus from the very outset, and you don't have this discordant process.
Yeah, but doctor, are we at the point still where it's voluntary? Because it seems as though if you can't have a job and you're going to get fired and you've got all these mandates, possibly even to get on an airplane, that doesn't sound so voluntary anymore.
No, it's becoming less voluntary, and you're seeing mandates across the
you think that's a good
across
thing?
The economy. I think some of the mandates from a public health standpoint I support. I think that the federal government certainly within its right to mandate vaccination among the federal workforce. It's a matter of readiness of the federal workforce. I do believe that healthcare workers should get vaccinated. We require healthcare workers to get vaccinated for chickenpox, for flu, for hepatitis B as a function of protecting the patients that they care for. I think when you're putting mandates, though, on private businesses down to the level of 100 employees, I have real questions about whether the benefits in terms of what you're going to achieve in terms of the incremental number of people who will get vaccinated is worth the disharmony that you're going to create, and the fact that you're going to turn something that is furtively political into something that's objectively political. Now people are going to oppose vaccination and oppose the mandates. So I think that that's a real question mark, whether or not the administration is going to pick up enough people in terms of additional people vaccinated that is worth the cost that they're going to pay in terms of the discordance around the country and the fights that we're going to see in the litigation around those small business mandates.
So much of this goes to trust, and we go back to where we're talking about sort of the back and forth guidance. This is the latest trust poll from our friends over at Axios about do you or do you not trust President Biden on the vaccine and on dealing with COVID, and it's actually flipped, essentially. It went from basically 60-40 trust the president to 60-40 not trust the president. What do you attribute that to? And you think the American people are right or a little misguided?
Yeah, I'm not sure what to attribute it to. I think it probably ebb and flows with what's happening with respect to the virus around the country, and we're still in the setting of this massive wave of infection from this Delta variant. I'm hopeful this is going to be the last major surge of infection. On the back end of this surge, prevalence levels are going to start to decline across the country. So I think a lot of that stems from just the wave of infection. I think a lot of it stems from the perception that public health officials and public health agencies aren't aligned on some of these critical questions. And I think some of it stems from what you said at the outset, that the guidance that consumers are receiving doesn't feel like it's interpretable, that it's reliable, that it's fully transparent, and that people have the ability to make an informed choice about what they will and won't follow based on some underlying measure of what the level of certainty is. We need to be much more candid as public health officials on what we know and what we don't know, and where we're speculating and where we feel quite certain.
The candor and transparency part you make a great point about, and I've watched you for a long time and admired your work on CNBC and other places, and always appreciated the way you called balls and strikes, sir. Thank you. Said what you don't know,
Thanks a lot.
which not many people do. Great conversation. Yesterday.